Hello friends, welcome back to Complete Medical Coding. Today let's discuss the remaining practice questions. Okay, this is the remaining practice questions from my previous video. Okay, the CPT navigation, how to navigate through the CPT code book. All right, so let's directly go to the questions. Friends, if you are new to the channel, please subscribe and yeah, let's move to the questions one by one. The first question, baby Tom was diagnosed with meningitis. His physician placed a needle through the fontanelle at the suture line to obtain a spinal fluid sample on Wednesday. The needle was withdrawn and the area bandaged. The baby required another subdural tap bilaterally on Friday. How would you report Friday's service? So we have to code for the service carried out on Friday. So initially, actually this patient, baby Tom, he's having meningitis. Then what else the physician did? The physician placed a needle through the fontanelle at the suture line to obtain a fluid sample on Wednesday. And then the needle was withdrawn and the area bandaged. So it means only the sample was taken on Wednesday. Now the baby require another subdural tap. So that is a procedure that is going to carried out on Friday. The baby required another subdural tap bilaterally on Friday. So subdural tap bilateral, that is a procedure that is going to carried out. So we have to report the Friday's service. So Friday's service here is subdural tap bilaterally. Okay. So go to the index page. I am already on the index page now. So you have to go to the index page and take subdural tap. You have to check for subdural tap. Take it out. Go to index page and take subdural tap. Marcus. You can take, you can go to the heading subdural. It will be the end since it is S. It's at the end. Yeah. Subdural. Subdural tap. Hope you got it. Subdural tap. So directly if you can see subdural tap, it's mentioned there only two codes, 61000 and 61001. So go and take those two CPT codes, 61000 and 61001. So from that you have to find out which is our correct answer. So what is 61000? 61000 is subdural tap, same. Okay, subdural tap through fontanelle or suture, infant, unilateral or bilateral initial. And then 61001 is subsequent taps. So here you have to find out whether this is the initial tap or subsequent tap. Anyway, the description is same as mentioned in the question, subdural tap through fontanelle, right? So for the infant, yeah. So is it an initial or subsequent tap? So in the second line of the question, it is mentioned his physician placed a needle through the fontanelle and the suture to obtain fluid sample. So that is a procedure, that is subdural tap procedure, but that was done on Wednesday. And then again, baby require another subdural tap on Friday. So it means it's a subsequent tap. It's not an initial tap, it's a subsequent tap. So here the correct code will be 61001. Okay, subdural tap through fontanelle for the subsequent, unilateral or bilateral. In the description it is mentioned unilateral or bilateral. So it means no need to add any modifier. Okay, so the correct CPT code is 61001. Now moving to the second question. A patient suffering from chronic inflammation of the maxillary sinus underwent a surgical endoscope transnasal balloon dilation procedure to restore normal sinus function. During this procedure, maxillary antrostomy with removal of tissue was completed. How should you report these procedures? So here, what is the procedure carried out? Surgical endoscopic transnasal balloon dilation procedure. So you have to code for surgical endoscopic transnasal balloon dilation procedure. Okay, so you have to take for the, you have to go to the index page and then you need to take the endoscopy. Endoscopy, surgical endoscopic transnasal balloon dilation procedure. Yeah. So go to, that is maxillary sinus and okay. Endoscopy of maxillary sinus. So it means sinus and nasal or sinus endoscopy you have to find out. So go to the index page and take endoscopy. Go to endoscopy first. Let's see what it will show. Endoscopy. So you take endoscopy, then take sinus. Yeah, under endoscopy, this is maxillary sinus, right? So sinus endoscopy. Under endoscopy, take sinus. Sinus, yeah. Under sinus, this is a surgical endoscopy, right? So under sinus, you have to see there are two different endoscopies, diagnostic and surgical. So since this is a surgical endoscopy, go for surgical endoscopy codes. It starts from 31237 to 31240, 31254. So many are there. So sinus. If you check maxillary, I think you won't find it. Maxillary sinus. No, you have to check all these codes. Surgical sinus, surgical endoscopy of maxillary sinus. So what is 31237? Check all those codes. 31237, 31240. You need to check everything. 3123. What is the first one? 31237. 31240. 31237 is nasal sinus endoscopy surgical with the biopsy polypectomy. No, it's wrong. This is not polypectomy. 31240. This is until 31240. Everything is related to nasal endoscopy surgical, see with control of nasal hemorrhage, with dacrocystorhinostomy. All these are wrong. 31240. No, this is not the one which we need. Conca ballosa resection. No. How is this procedure carried out? That is mentioned in the second last line. During this procedure, maxillary antrostomy with removal of tissue was completed. Okay, just keep in mind that also. What is the next code that we need to check? 31254 to 256. 254 again, nasal sinus endoscopy, surgical with ethmoidectomy. Partial. No. Again total. No. Again total. 31256 is antrostomy, nasal sinus endoscopy, surgical with a maxillary antrostomy. Yes, that is there. Still, let's see what are the other codes mentioned here. 31267, 276, 267, 31267 with removal of tissue. Yeah, with removal of tissue from maxillary sinus. That is also as part of our question. Now, what is the next code? 31276. 31276 in nasal sinus endoscopy surgical with frontal sinus exploration. No, that's wrong. So 276 is wrong. What is 3128788? Nasal endoscopy with the sphenoidotomy. No, that's also wrong. Both are wrong. 87 and 88 are wrong because it's sphenoidectomy. Sphenoidotomy. Now 31290 to 31297. 31290. Nasal sinus endoscopy surgical with repair of cerebrospinal fluid. No. So 31290 is wrong. 29130 again wrong. 292 nasal endoscopy with medial or inferior orbital wall decompression wrong. Now 31295 nasal sinus endoscopy surgical with dilation of maxillary sinus. Dilation of maxillary sinus ostium, example balloon dilation, transnasal or via canine fossa. So here, yeah, transnasal balloon dilation procedure. This is what we need. Okay, nasal endoscopy with surgical endoscopy with dilation of maxillary sinus ostium, means example balloon dilation. So this is a balloon dilation of maxillary sinus. That is why in the question it is clearly mentioned in the first line. The patient underwent a surgical endoscopic transnasal balloon dilation procedure to restore normal sinus function. Okay, and during this procedure, along with that procedure, the maxillary endostomy with removal of tissue was completed. So whatever description that we read before on the previous codes, which says about this maxillary endostomy, we might think that that could be the CPT code, right? The, what was that, 31267, 31256, 31267 CPT codes. We may think that this is the correct one, but no. This is the additional procedure that is carried out along with the current procedure. So the current procedure here is transnasal, endoscopic transnasal balloon dilation. That is the current procedure, but along with that additional procedure, maxillary endostomy is performed. So we got the correct CPT code for transnasal balloon dilation as 31295. See, below there is paragraph, in the bracket it's mentioned, do not report 31295 in conjunction with 31233, 31256, 31267 when performed on the ipsilateral side. Yeah, so we should not report this 31295 along with the 31267. What is 31267? The same, nasal endoscopy with maxillary endostomy with removal of tissue from maxillary sinus. So don't report that one separately. It's already included. That is what it is mentioned here. Okay. So you have to code only 31295. You should not put 31295 and 31267 together. Although there are two procedures carried out, you have to report as per the description. We have to report only 31295. Okay. So the answer here is, the correct CPT code here is only 31295. Okay. Hope you understood. Now let's move to the third question. Okay. A pregnant patient presents to the hospital in active labor. The obstetrician providing her prenatal care is contacted to perform the delivery. The provider delivers twins vaginally. The obstetrician will also provide the postnatal care. What CPT codes describe this procedure? So this is a simple question, right? From the question it's clearly understood that delivery of twin delivery vaginally, twin vaginal delivery. That is what we need to code. Nothing else. Along with postnatal care. Anyway, nothing else is mentioned. So we have to code for delivery of like vaginal delivery of twins. Okay. So anyway, there are global codes. I had taken global codes in I think when I had taken 50,000 series. Anyway, you know that delivery and all maternity, everything comes under 50,000 series. So I had already taken that before, when I had taken 60,000 series, the chapter reproductive system chapter. I think I had already taken I had taken what is that, the global codes. So you have to keep in mind all those global codes of maternity, like like vaginal delivery, cesarean delivery, all those 3 or 4 global codes are there. Yeah, that you need to Keep in mind. So you don't have to go to index page when you get questions like this. Delivery questions. When you get questions like this, you don't have to go to the index page and check. Okay. So here I am directly taking 50,000 series from the CPT code book and going to the vaginal delivery topic. Okay. Otherwise, you can go to the index page and take vaginal delivery. From that, you will get the series of codes. It starts from 59400. Okay. 59400. It starts. Anyway, here we need, see, here also postnatal care is performed. So routine obstetric care for twin vaginal delivery. That is what we need to code. So what is 59400, the first code under vaginal delivery? 59400 is routine obstetric care including antepartum care, vaginal delivery with or without episiotomy and postpartum care. Yeah, this code we need. But since this is a twin delivery, twin delivery, you have to code again. The description which is showing in the CPT code 59400, that is only for a single delivery. Okay, usually it is by default a single delivery. If it's twin, you have to code it again, but don't mark it again with some other modifiers or like that. Go to the next CPT 59409, vaginal delivery only, with or without episiotomy. Yeah. So 59409, that is vaginal delivery only, because in the CPT code 59400, routine obstetric care, everything, even though it is a single delivery or vaginal delivery, the routine obstetric care for prepartum and postpartum care, it will remain the same, right? That is for the mother. So that obstetric care remains the same, irrespective of the number of babies. Okay, so that routine obstetric care will be a single code 59400. And for the next delivery, the twin, the second baby delivery, that's again vaginal delivery, you have to add add 59409 as a CPT code and mark it along with modifier 51 because it's a multiple procedure. Modifier 51 is multiple procedure. Okay, vaginal delivery only. Yeah, second vaginal delivery. So it's a multiple procedure when compared to the first code. So you have to code. So the correct codes here will be 59400 and 59409 with modifier 51 because it's a multiple delivery, multiple procedure. Okay, hope you understood. So routine obstetric care, here you need to code only you need to mark the routine obstetric care only for one code. Don't mark it twice. That is why the second code is description is like that, vaginal delivery only, like that. Okay. So mark it with modifier 51 to identify that it is a twin delivery. All right. Twin or multiple, yeah, whatever it is. So fourth question. Yeah, fourth question. A patient suffered a penetrating knife wound to his back. A surgeon performed wound exploration with enlargement of the site, debridement and removal of gravel from the site. The surgeon decided a laparotomy procedure was not necessary at this time. Laparotomy procedure was not necessary at this time. How would you report this procedure? So read the question carefully. Don't make confused that it is mentioned, okay, oh, laparotomy, okay, without reading it completely, don't go to index and take laparotomy. No, here what is the surgeon mentioned? The surgeon has mentioned that laparotomy procedure is not required. So what is the procedure carried out here? Only wound exploration, right? Surgeon performed wound exploration with enlargement of the site. That is a procedure carried out here. That is what we need to code. Wound exploration with enlargement of the site. Okay. So go to wound exploration. Go and take wound exploration under index page, or you can take exploration also. Yeah. Go to exploration, wound exploration, but take exploration. In the index page, go to exploration and then go to wound. But where is the wound here? On the back, right? So patient suffered penetrating knife wound to his back. So backside wound. So go to exploration and take back. Where is the location? Back. So under back, what type of wound it is? Penetrating knife wound. So it's a penetrating wound. See, this is very easy to find the answer. Okay. So go to exploration. Then take back because wound is in the back. And then what type of wound it is? Penetrating wound. See, you directly got the answer, the CPT code 20102. In the index page itself, you got the answer. Still, you can go and check what is that CPT code description 20102. Exploration of penetrating wound, abdomen, flank or back. Yeah. So this is our correct answer 20102. Okay. Now moving to the fifth question. Let's discuss the fifth question now. Annie presented to her primary care physician with pain and swelling in the right elbow. After careful examination, he referred her to an orthopedic surgeon for a second opinion. Dr. Joy diagnosed Annie with acute osteomyelitis of the olecranon process and recommended surgery. Annie agreed to the surgery and underwent a sequestrectomy through a posterior incision with a loose repair over drains ending the procedure. Dr. Joy sent a written report back to Annie's primary care physician along with the operative report. How would you report the procedure? So, what is the procedure the service carried out here, and what is the procedure? What is the code that we need to? I mean, what is the service that we need to code? Almost in the mid of the question, it is mentioned. Annie agreed to the surgery and underwent a sequestrectomy. So, sequestrectomy is the procedure that we need to code. The question looks little bit and little complicated. Not complicated, but it looks little bit. But just read the question carefully and try to understand what exactly we need to code, or which part that describes what we need to code. Okay. So that is in the almost in the middle line. Annie agreed to the surgery and underwent a sequestrectomy. So it means the sequestrectomy is the procedure that is carried out here. Okay. Through a posterior incision. Yeah. So go to index page and take sequestrectomy. This is also easy to find the answer, to find the code. Okay. So take sequestrectomy. PQRS. Sequestrectomy. Yeah. Under sequestrectomy, which part it is? Right elbow. So, under sequestrectomy, right elbow, you can't find right elbow there. So, just read some other line on the, just one line before. Dr. Joy diagnosed Annie with acute osteomyelitis of the olecranon process and recommended surgery. So, what is the diagnosis here? Osteomyelitis of olecranon process. So, just check below sequestrectomy, below the heading sequestrectomy in the index page. What are the headings mentioned? Carpal, clavicle, humeral head, humerus, olecranon process. Check if elbow is there. Radius, scapula, skull, ulna, no. Olecranon process is there. Okay. So here, since it is mentioned olecranon process under sequestrectomy procedure, you need to go with the olecranon, because olecranon process is the process which is carried out in the elbow joint. Okay, it's a posterior. The process carried out on the posterior side of the elbow joint. So that is why there is no separate elbow mentioned under sequestrectomy heading. So here you got olecranon process. What is it? The CPT code mentioned there 24138. So go and take 24138. What is the description? Sequestrectomy. Yes, this is what we need, right? Sequestrectomy example for osteomyelitis or bone abscess, olecranon process. Yeah, this is what exactly we need. 24138 is the correct CPT code here. And then, since the procedure is carried out here in the right elbow, you have to mark it with a modifier right, RT. Okay, so the correct CPT code here is 24138 with modifier RT. Alright, so this is how you need to find out the answers. you need to find out the CPT codes. This is how you need to find the CPT code, the codes from the index page. Okay. So friends, hope you understood. Hope you like the video. Hope this video is little useful. So if you find this video useful, or if you understood this video, please like and please share it among all of your friends. Okay, to make them understand how to navigate through the CPT code book. Okay, and let's discuss more questions. I'll be coming back again with more and more practice questions and more questions in the upcoming videos. So friends, please stay tuned. And those who are new to the channel, please support me by subscribing to the channel. And those who have already subscribed, thank you so much and stay tuned, friends. Those who have already passed the examination also, you can watch my channel, my videos, because in between I am coming with some interview questions, some topics which is related to your career, which can be helpful in your interview and which is very useful in your career. Okay, like the one which I had uploaded yesterday, the Medicare global periods, like that. So you'll be getting few topics in between. So please stay tuned, friends, and let's see you in the next episode. Thank you so much. Bye. Take care.